Shouldn't be, but oh.
Okay, good morning, everyone. Welcome to our meeting today. We have a really good speaker from Ohio Health who's going to talk to us about the new Dublin Cancer Center, and a few other guests from there as well who will be introduced shortly. We're going to kick off today with our invocation by Julie Rinaldi, and then Steve Schmidt is going to lead us in our pledge.
Good morning, everybody. This is a prayer from St. Francis of Assisi I've abbreviated, but you'll recognize it. Make me an instrument of your peace. Where there is hatred, let me sow love. Where there is injury, pardon. Where there is doubt, faith. Where there is despair, hope. Where there is darkness, light. And where there is sadness, joy. Amen.
Amen.
All right, if you'll join me, I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Julie, and thank you, Steve. If you have a guest today, would you please unmute yourself and introduce your guest?
Well, there's several guests with Ohio Health, and I'm not sure who all is on here. If y'all could, each one of you, unmute yourselves, and starting with Brianne, introduce your position with Ohio Health.
Hi, good morning. Thanks so much for having us. I'm Brianne McFarland. I am the Philanthropy Advisor for Ohio Health Foundation at Dublin Methodist and Grady Memorial. Thanks for having us. Mark is here as well.
Good morning, everyone. Mark Manja, also from the Ohio Health Foundation. I have the privilege of working with our cancer programs across the system. And we also have our speaker here, but David, I don't know if you want to hold back and add some suspense on that front. So
yeah, Calvin is going to introduce the speaker in a minute.
Greg,
I think we've got Greg here. Unmute yourself.
Greg, you're still muted.
Well, welcome, Greg. Greg is here from Ohio Health as well, and
he's leading our committee for the Dublin Cancer Center, and we have a huge goal that Greg is undertaking, a $10 million goal over 5 years, and he's done an amazing job leading that initiative. We just started that this year, so thanks, Greg, for all you do. Is anybody else here with Ohio Health? I'm kind of scrolling through the screens.
aside from Dr. Dubé, that's it.
Okay, we'll hold off on Dr. Dubé.
Okay, do we have any other guests that are not from Ohio Health today? All right, well, thank you for everyone for being here. Thank you, Bonnie, for introducing those guests from Ohio Health. And do we have any announcements this morning? Susan West, did you want to talk about the 125 Club?
Yes, I do. Last chance to join the 125 Club. If you want to donate $25 to Polio Plus and $100 to the annual fund, please get on board. We have had quite a number of members step up, and I do appreciate that. And for your efforts, we will give you a bottle of wonderful Jameson whiskey or a special label bottle of Kettle One vodka. And I'll be distributing that at our next in-person meeting, which is November 6th. So thank you so much for those of you who have already stepped up, and we've got room for more to give. And I'll remember that if you donate to Polio Plus, the Bill and Melinda Gates Foundation will double your donation. So we're so close to eradicating polio entirely. So real important that we continue to give to make this thing final. So that's it.
Thank you, Susan. How many people have signed up already? I know it's a record from compared to even last year. How many do we have so far?
I think we have 39 at this point.
Wow, that's incredible.
So thank you so much to all of you who have stepped up. I certainly appreciate it. Oh, and if you want your bottle of liquor before the 6th, email me and we'll make arrangements. So hopefully you don't need it for the game tomorrow, but that's okay.
All right, thank you. That's super. That's a great showing for our club. I think that's the most I've seen in my time with the club of 125 participants in a year. So if you haven't signed up yet, please do. We've got another week left for you to get into the program. Any other announcements this morning?
Yep. Can you hear me okay?
Yes, Roberta, we can
okay,
hear you.
Well, two things. We are still collecting toiletries and food for the food bank. You can either take it directly to the Dublin Food Bank at the church in downtown Dublin, or you can drop it off at David's home. And he can take them to the pantry, or I'll pick them up. And we're also collecting coats through the 31st. I was looking at the date. So you can drop them at David's home, or I can come pick them up from your porch. It'd be nice if we get more collections. And the other thing is you can also donate directly to the Dublin Food Pantry, since just go to dublinfoodpantry.org, I think, or Columbus Foundation, and click on Dublin Food Pantry and make a donation. So some people have dropped off stuff. I'm sure there's others that would show up at a meeting and would be fined if they didn't have any. So you know who you are. Just make an effort and drop your stuff off or make a donation. And secondly, I think only 3 Rotarians have bought the calendars that I'm selling as a fundraiser for Rotary. I have sold them to friends and other networking people that I know. So they're the current order is almost sold out, but I would like to see more Rotarians buy them. If you don't use a calendar, give it away. Use it as a gift. But my cost is like $11 or $12. So out of that $25, $13 goes to Rotary. And I've raised several $100s for Rotary already. So that's it. Thank you.
Okay, thank you. Thank you very much, Roberta, for your efforts in all those fronts. Big thanks to Jim Bandine, who dropped 2 big boxes full of jackets on my porch this week for the coat drive. If you got any coats in your closet that you don't wear anymore, please pull those out and let's get those to people who need them. Any other announcements this morning? Okay, well, I'm going to turn over the podium to Calvin Gebhardt to introduce our speaker for the morning.
Thank you, David. I have the opportunity to introduce Dr. Dubé from Ohio Health. He is Vice President of the Ohio Health Cancer Services. He is board certified radiation oncologist and has been practicing in the Columbus for over 20 years. He is also an MD Anderson Cancer Network certified physician. Dr. Dubé graduated medical school from Northeast Ohio Medical University and completed an internal medicine residency at Ohio Health Riverside Methodist Hospital and a residency in radiation oncology at the University of Texas MD Anderson Cancer Center in Houston. He and his wife of 25 years live in Upper Arlington and are very proud of their two beautiful daughters who are both currently pursuing careers in medicine. Dr. Dubé, we welcome you.
Thank you. Can you all hear me? Great. Then I'm going to share my screen. If I can get this to work, let's see. All right. So can you all see my screen? This is a presentation. So what I wanted to do, thank you all for inviting me today. I very much appreciate the opportunity to talk to you all. Today is really to talk about a couple of things. One is obviously our plans for Dublin and the Dublin Cancer Center, but more broadly, what our vision is for cancer care and where Ohio Health fits into that spectrum of care, at least in central and our 47 county footprint. So, you know, we at Ohio Health have been looking at what we wanted to do and who we want to be going forward. And we understand, you know, there are strong competitors in our marketplace. And so we have adopted this vision statement, and it's packed with a lot, so I'll read it. Ohio Health will collaborate with our physician partners to build a comprehensive system-wide cancer service line that delivers exceptional outcomes, expands services and geographic reach, and secures recognition for Ohio Health as Ohio's preferred cancer care network. In that statement, there's a lot. And one is, we're going to collaborate with our physician partners who are high quality, excellent providers to build this out. We are going to deliver exceptional outcome and geographic reach, and that's where Dublin Cancer Center comes into this picture. And then we also want to secure our reputation recognition as being Ohio's preferred cancer care network. The reason that we chose Ohio is because, as you all know, in Ohio, we've got national players. We've got Cleveland Clinic and we've got Ohio State. And, you know, if we are able to successfully complete and deliver excuse me one second here, and my daughter's calling me, which kind of, all right, I'm sorry about that. I'll let my wife pick that one up. So, you know, we have strong competitors regionally, and we feel if we can successfully compete on a level of care delivery and quality, then we are on the national stage. So that's our intention in 5 years, is to grow out our cancer program and to build it out. This is where we are. We're in 33 counties. We have infusion, radiation, surgery, genetics, personalized medicine. And we intend to continue to deliver care closer to home. And this is the Ohio Health strategic framework, meaning we want to excel at our core business. We need to exceed our consumers' expectations, and we need to diversify. The goal here is to deliver care where people are. So we have these concentric circles of how we deliver our care. One is the pipeline, where patients come from. So they come from PCPs, emergency physicians, and other patients and family members. Community hospitals, where we deliver radiation oncology, infusion, medical oncology, and telemedicine. And Communities Plus Hospital, where we have the full slate of services, but we don't offer the highest complexity of care. And then where Dublin fits into this is the tertiary care facility, where we have a full complement of radiation oncology, medical oncology, surgical oncology, and then providing leading edge technologies. And then quaternary care are places that have very high complex programs like bone marrow transplant that are delivered in very few places across the country. So, you know, this is our journey. And this is initially in order to expand our programs, including a comprehensive cancer facility in Dublin. We first had to establish cohesiveness. So we established what was called the service line. We had 8 hospitals and 100 plus providers. We needed to make sure everybody was aligned. Then we needed to develop clinical quality and consistency. And that was really by making sure that all practitioners were providing a high level of care in a consistent way. And that's where we brought MD Anderson into the equation. So MD Anderson is a cancer facility in Houston. It's the #1 cancer facility in the nation per US News and World Report, and probably in the world. And they have come in and become a partner with us in terms of auditing our practices, our facilities, and then our physicians become certified. And so every physician that has an MD Anderson certification that you or your family members might see adheres to best practices and is endorsed by MD Anderson as a certified physician. So we did that in 2014 through 2018. So we had 8 facilities that got certified through MD Anderson and 70+ physicians. So that quality baseline really let us move into the following phase, which is where we are right now, which is expansion of programs in our footprint. And so what we are doing now is, after having identified, or rather gone through the process of creating these paradigms and consistencies around our system, what we wanted to do is figure out, where do we need to establish facilities that meet patients where they live, and what programs do we need to develop in order to deliver on the types of care that the patients need where they are. So where we are right now is, obviously, we do a gap assessment, we expand our programs and technologies, and then we brand ourselves. And we'll get into that in a minute. And then 2025 and beyond really has to do with creating an analytics infrastructure that allows us to report out our outcomes in a way that patients will be able to consume and understand. So this is how we've done this. In 2014, we only had Grant and Riverside as MD Anderson certified. Today, there are 8 certified hospitals. Of them, Dublin is one of them. In 2017, we began accessing clinical trials, and a huge motivator for patients to seek care at academic facilities is the fact that there are clinical trials that are available there. We have embarked on using MD Anderson clinical trials, so we have a number of them that we have deployed, as well as a number that we're considering. And then, as of last year, we launched Precision Medicine Survivorship, and we renewed our relationship with MD Anderson. So precision medicine, for those of you who are not in cancer, is using a patient's genetic and genomic data to deliver targeted therapy. So you take their tissue, you sequence it, you identify what is their ideal therapy, and you proceed with delivering them a molecular-based therapy. It's where cancer is headed, and we're firmly in that space. In doing our gap analysis, we looked at like health systems and said, what is everybody doing? What are we not doing? And we identified some gaps that we need to close. Soft tissue sarcoma and bone tumors, skin cancers, head and neck, lung cancer, esophageal cancers are areas where there's room for improvement. We do not have a bone marrow transplant program. So those are areas where we are going to be focusing our efforts in the coming years. So this is kind of the way that we went about it. One was to find out physicians' preferences and whether or not they would participate. Obviously, physician alignment is a huge key. And that has a lot to do with bringing oncology services to the Dublin Cancer Center. We have partners in medical oncology with COA, Columbus Oncology Hematology Associates. They are a very high quality provider, and we're thrilled to be partnering with them. So we need physician alignment to get these things off the ground. We need to understand what services we're offering. Do we have outpatient palliative care? Do we have clinical trials? Do we have screening programs available? So that was yet another thing that we looked at, not only system-wide, but at Dublin. What facilities do we need, and how do we need to enhance them? And so, do we need to add additional mammography capabilities? Do we need MRI, et cetera? So we did a deep dive into what additional facilities enhancements are required to deliver on top level care. And then patient experience. And this is really a key component to our initiative at Dublin, which is when a patient walks into Dublin Cancer Center or walks into Dublin Methodist Hospital, are they getting a best-in-class experience? And B, are we making it easy, affordable, and straightforward for them? We know that going to large academic facilities or even big hospitals is complicated and difficult for patients, particularly who are dealing with substantial health issues. And so making it simple, welcoming, easy is a real focus of where we want to go. This is our gap analysis. I won't get into this too much, but a foundation for any cancer program has to be physician alignment. You need to have a robust prevention and screening program. You need to have navigation, meaning you need to have a nurse helping a patient through the complex maze of appointments and testing that goes on with cancer patients. We need to have specialized care, and we do, and I'll get into that in a moment. Point of care testing is going to be available at Dublin, where a patient will be able to get their labs and their chemotherapy and cancer treatments on the same day. You need to have access to clinical trials. We talked about that. And then survivorship. What do you do with patients after they've completed their active treatment? They have a number of needs, both social and sexual and financial. So survivorship programs do wrap around patients that provides the support that's required, and we do have that in Dublin when it opens, or we will. Just really briefly, I'll go into bone marrow transplant. I won't spend too much time on that. Bone marrow transplants are very highly complex programs where, obviously, as you all know, they're primarily used for lymphoma, leukemia, myeloma, and they represent really the most complex medical procedure that we do. We currently send our bone marrow transplants elsewhere, primarily to Ohio State, and we thought to ourselves, what are we going to do as we try and build out our program? Do we want to get in this space? And we said, listen, as an organization, we feel like we deliver on a high level of service to patients that's really second to none. So we're doing disservice to our patients by sending them elsewhere. We want to also be a comprehensive cancer program. And so, we looked at our footprint, we looked at the number of transplants that were being done, and we looked at other organizations to say, should we do this? And we talked to these organizations. We talked to Scripps in La Jolla, California, Advocate in Chicago, Intermountain in Utah, and Methodist in Houston to say, all right, is this a program that we can successfully launch and run? And the answer was a resounding yes. This is our footprint. This is the number of transplants that are being done. There are about 385 that are being done within our demographic on any given year. The number of transplants is going up year over year, so it's not a technology that's going away. So we decided to move forward on a transplant program, and that will hopefully be off the ground in another year and a half or so. The other thing that is interesting that this group should probably know about is the fact that Ohio Health will be getting into advanced cellular therapies, which are CAR T and CAR NK. So there are patients who were previously incurable, who had advanced lymphoma, leukemias that had no options. What we do with these patients is you take their own immune cells, their T cells, you condition them to the patient's tumor, and then you send them back into the patient, and that delivers a very high rate of cure. We cannot do CAR T and CAR NK therapies unless we're FACT accredited, which is a bone marrow transplant program. So we're doing these things in tandem to create, obviously, a service for patients that need them, as well as a pathway to getting to the most advanced therapies that are available in cancer today. So here are the elements of our cancer program. And again, I'll get into the Dublin Cancer Center in a minute, but we're MD Anderson certified. We intend to remain certified. Some of the metrics that we use to identify where we were before and after our certification with them or affiliation with them were, are we concordant with national guidelines? Are we staging people properly? Are we offering them survivorship opportunities? And the answer was, looking back in 2014, we were not as concordant as we hoped we would be as a system. But by the time we became certified in 2016, we were concordant 99% of the time. So that was not just for Grant and Riverside, but that was for the entire system. So the MD Anderson relationship has given us a level of quality and assurance to our patients that we're delivering on that quality that has really moved the ball for us. It's been a bit of a game changer. It's also offered clinical trials to patients as I alluded to previously. We're able to offer trials that were previously in the domain of an Ohio State or a Cleveland clinic. So patients who come to us, and when they come to the Dublin Cancer Center, will have the option of participating in these trials as well. And so precision medicine is molecular-based medicine. I alluded to that as well, which is Dublin Methodist and the Dublin Cancer Center will have precision medicine available to patients where you test their tumors for targeted therapies. And we have a molecular tumor board that looks at all the cases to make sure that we're delivering it properly. And then finally, survivorship was established, which is essentially saying to patients, you've received chemo, you received radiation, you've had a surgical procedure. Now what do? People have specific needs with respect to physical therapy, occupational therapy. They have obviously difficulty at times if they've been treated for head and neck cancers with swallowing and nutrition. How do you wrap services around a patient after therapy? Because once the patient has completed therapy, in our previous model, there really wasn't much. And so that too is going to be available in Dublin. So now we'll get into the Dublin Cancer Center, and I'll leave this slide up for a minute. For those of you who have been on Perimeter Drive, you've probably seen this large building going up. It's the 30,000 square foot facility that Ohio Health and Columbus Oncology have collaborated on. It is a unique partnership. And through Greg Vredenberg's constant reminder that we need something in Dublin, and through the Dublin Development Board, it really did push us in a direction where we got this off the ground relatively quickly. And I'm very proud to be working with Columbus Oncology. I'm proud to be able to deliver this service close to home, and the quality and unique nature of this facility is going to be fantastic. So what this facility is there is medical oncology. So chemotherapy, medical oncology will be housed here, but also there will be imaging, mammography and screening. There will be survivorship, there will be research, there will be precision medicine, there will be physician surgeon offices over there as well. So breast, colorectal, prostate, and all our surgical specialists will be in that building as well. So the idea of having a cancer center that has all of these services co-located is A, convenient for patients, and B, ideal for patients or for physicians and staff to communicate with one another. So the holy grail in cancer therapy is multidisciplinary care, where you bring everybody together and you talk about and you decide what types of treatments are going to be best for patients to go through and in what sequence. It used to be you would see a surgeon, you'd go to a medical oncologist, you'd go to a radiation oncologist, you'd do it all in sequence, all at different places on different days. The goal here is to do this all in the same day for physicians to talk about their cases. Should the patient get chemo first, or should they get radiation first, or should they get chemo and radiation together? What is the timing of surgery? How do we involve research into their care? So this facility and this approach represents a real advance for patients, not only in Dublin, but for all of Ohio Health. This is really going to be the first of its kind. So we entered into a relationship with Columbus Oncology. The reason we chose Columbus Oncology, some of you may have family and friends who have gone to physicians there. They're an extraordinarily high quality provider, and they've only been at one site for the last 30 years, which is adjacent to Riverside on Jason Way. We said to them, we would love to provide service in Dublin. You all are really superlative in terms of the quality of care that you deliver. Would you consider coming out to Dublin? So this is their first entry into lateralizing their care. And we're glad that they did it. We're glad they chose Dublin. And before you know it, we entered into an agreement, and this building is under construction. This facility will be open in May of 2021, and we will be obviously seeing all variety of patients there. The services that are offered here are, as I mentioned, all the above. The radiation oncology facility at Dublin Methodist Hospital is right across the street, so that makes it equally convenient for patients to see the radiation oncologist and get their treatment as well. Kind of the logistics of having a linear accelerator and all the requirements of radiation facility make it better and easier to be on a hospital campus. But we wanted to make sure that it was equally convenient for patients going forward. So that's the Dublin Cancer Center. We're really excited and thrilled about being able to offer the service to patients in Dublin. And then finally, we had to look at where what services that we needed to start offering. And this goes for Dublin as well, meaning, we are we able to deliver, the vast majority of care in Dublin? The answer is yes. So we got physicians and allied health professionals together to say, all right, what do we need to build out? We talked about sarcoma and thoracic oncology. Dublin is going to be a site for minimally invasive thoracic surgeries. And we will have a thoracic surgeon available at the Dublin Cancer Center. So all of these are to make the patient's experience better, to make it convenient for them to receive their care, to make it seamless, and obviously provide the support that's required for patients who are going through a very difficult time. And I'll conclude with kind of where are we right now. These are our facilities that Ohio Health currently has in the region. We have Mansfield, Shelby, Marion, Kenton, Athens, and Circleville. These are all Ohio Health facilities. So when you look at Dublin, the Dublin Cancer Center, this is our first foray into collaborating with a group that is not employed by Ohio Health. And so if you look at Central Ohio and where we are currently, we've got Riverside, Grant, and Dublin as our anchors in our cancer program. So when I said that Dublin Methodist Hospital represents a tertiary cancer facility, we're doing a very high volume of robotic prostatectomies. We're doing a vast majority of our free flap reconstructions for breast cancer are being done in Dublin. And we have radiation oncology services there. So as a community, Dublin already has a strong asset in Dublin Methodist Hospital, and will continue to advance our mission by building and opening the Dublin Cancer Center. So with that, I will stop, and I will leave it to any questions.
Dr. Dubé, I have a question. Being in Columbus, we hear a lot about the James Cancer Center. Can you kind of comment on do you have any affiliation with the James? What's the difference between what's going to be happening with the Dublin Cancer Center versus what goes on with James? Help kind of educate us as consumers on the difference there.
Yeah, we do not have an affiliation with the James. The James is a comprehensive cancer facility, is designated by the National Cancer Institute. So they provide a broad variety of services, and they certainly do a good job. And what I tell patients, and obviously we discuss this with our colleagues, is our goal is not to suggest that we're going to provide a higher quality of care at the James or provide better outcomes. We know that they do a great job. We will do the same, and we feel like we can do the same. What we want to do is, Ohio State and the James is fairly closed in terms of collaboration opportunities. We tried years ago to develop a stereotactic radiosurgery program with them. And what happens with change in their leadership is they decide, whether or not they're going to participate after we're already down the road in trying to develop a program. So we never felt that they were going to be a reliable partner for us in building out all the programmatic elements that we wanted. So whether that included bone marrow transplant or stereotactic radiosurgery for brain disease, or whether that included any slate of services, because once we collaborate with them and they decide they no longer want to collaborate with us, and that's happened, then we're left holding the bag, and our patients are too. So our goal in cancer care was to say, all right, we understand this is the dynamic. We're going to build out a cancer program that is every bit as good and deliver a patient experience that is superior. And so this is the impetus for us to develop a bone marrow transplant program and a sarcoma program and a minimally invasive robotic program. And we've been highly successful in doing that. So that's kind of our history with the James. We do not see any real, and I believe this to be true for Mount Carmel and any other system that's trying to work with them. We do not see a long-term relationship with them where we do not put ourselves and our patients at risk. And so that's why we're doing what we're doing.
Hey, Dr. Dubé, it's Greg here.
Yeah.
What I say to people from a fundraising standpoint is when they're asking as far as competition about the James, I don't look at the James as competition for us and what we're trying to accomplish. Our goal was to bring so many of these day-to-day cancer-related services to the northwest quadrant of the city. And that's what we're doing. Certainly the James has their place in the research. Some people want to be close to home. Friends, neighbors, people we all know that are going through regular chemo. They get so sick sometimes. They have care providers taking them to and from. We just wanted to make things more local. And that's what Dr. DeBay has tried to provide us.
Thanks, Greg. And I did want to say this, which is absolutely true for Ohio Health's focus on Dublin. We intend to deliver 99% of cancer care at Dublin, meaning we already have breast, prostate, colorectal. We're going to have gyn-onc. We're going to have minimally invasive thoracic operations done there. We're going to have an inpatient and an outpatient footprint there. We're going to have survivorship and precision medicine. All the elements of a cancer program are going to be present there. The only thing that we likely will not be doing there are bone marrow transplants. So, you know, my assurance to Dublin and the community is, and also statement is, we will be delivering a level of care close to home that will be equal to any place that you can go in the nation, quite honestly. So there would be no compromises here.
Dr. DeBay, we had another question come in through text. Rich asked, how many employees will the Dublin facility employ? And do you have any numbers on the economic impact the center will have for Dublin?
I do not. Marcom does have those numbers. I do not. The number of associates working in that facility I believe is around 100. But I would have to check with our business development and marketing team to validate those.
Okay, do we have any other questions for Dr. DeBay? Remember to unmute yourself if you want to talk. Okay, well, Dr. DeBay, I'm going to thank you for being here today and for educating us about what's going on. It's very exciting. Obviously, this is going to improve the lives of a lot of cancer patients in our area and their families tremendously. And I think what you're doing is really, really great. I think everybody here has been touched by cancer, either directly or indirectly. I know I have, and I think the work you're doing is extremely important. So thank you for sharing with us today. Thank you, Breanne, Mark, and Greg, also for being here from Ohio Health. We appreciate that. And please come back to any of our future meetings if you would like to be involved in the Dublin A M Rotary. We meet every Friday at 7:30. Right now, primarily Zoom. We're doing some meetings at the country club as a hybrid, but every meeting's on Zoom right here every Friday morning, starting at 7:45. Yes.
Hey, Dave, it's Greg. As a shameless promoter of this, I can't get off the phone without asking for everybody's help in both getting the message out that this place is going up. We have to get on the advertising side, just making the community aware, and also your help as business leaders getting out there. We will need help. We're going to be raising $10 million over the next 5 years. So certainly we need help from business leaders getting that message out, working with those businesses if it's appropriate to do so in some fundraising capacity. So we're not going to give up. Hopefully you'll continue to hear about this and think about us on a regular basis. I always end it by saying, this is for all of us. It's for our families. It's for our neighbors. It's for the community. So hopefully we keep thinking of it in those terms, because you're right, Dave, it's affected everybody and sadly will continue to. So thank you for allowing us to be on here today.
And thank you for that, Greg. It is. It's going to be a huge addition to our community, and we have to look at it that way. It's like this improves where we live and the way we live. So thank you for that message. Next week, we're going to have Ryan Scribner and Colleen Gilger from the City of Dublin Economic Development. That will be a Zoom-only meeting right here where we are today. Same link. And our quote from this morning comes from Steve Jobs, who fought and survived pancreatic cancer for 8 years before passing in 2011. He said, "Remembering that you are going to die is the best way I know to avoid the trap of thinking you have something to lose. You are already naked. There is no reason not to follow your heart." So everybody, thank you for being here today. Have a
Thank you
great
all.
weekend. Thank you, Dr. DeBay, and everybody from Ohio Health. And everybody have a great weekend, and we'll see you next week.
Thank you, everybody. We appreciate it.
Thank you.
Bye-bye.
Hey, everyone.